Welcome, and thank you for joining us for the Social Security Work Incentives Informational Session. I have been trained and certified by Social Security to provide work incentive counseling. If you are receiving SSDI or SSI cash benefits, DRCs can assist you in achieving your goal of returning to work through the Ticket to Work program. As an employment network, the Career Center of Orange County provides the following services: career planning, which can include consulting with a trained career counselor, training programs to upgrade your skills. Eligibility requirements apply. Job search assistance, resume development, ongoing employment support, benefits counseling and advisement, as well as referrals to support agencies, including all of the services offered at our Career Center. All Social Security beneficiaries have health insurance. For SSDI beneficiaries, you will have Medicare health benefits. However, there is a 24-month or 2-year waiting period for Medicare to become effective. During this waiting period, beneficiaries are covered by another type of health insurance. For SSI beneficiaries, they have Medicaid health benefits. Okay, let's get down to the nitty-gritty about SSDI work incentives. SSDI will provide a beneficiary with a full year to work while they continue to receive their full benefit check. During this time, you can earn as much as you would like and still receive your full benefit. What SSI does is they break down those 12 months into categories. The first 9 months are called trial work period months. For each month that a beneficiary earns more than $910 gross per month, that is considered to be a trial work period month. Each month you will know if you used a trial work period month. We will keep track via a calendar developed specifically to track SSDI work incentive use. These months do not need to be consecutive. SSA will give you 60 months or 5 years to use those trial work period months. Sometimes, due to the health of some beneficiaries, they are only able to work in the warmer months, and that's okay. Okay, after you have completed your 9 trial work period months, Social Security will monitor your income to see if you are able to earn substantial gainful activity level income. The amount associated with SGA level income is $1,260 gross per month. After you complete your 9th trial work period month, you will have 3 more months left. If you earn SGA level income for 3 consecutive months, by the 13th month, your SSDI benefit will end. However, you move into another period of protection. This period of protection is called Extended Period of Eligibility. This means that if you lose your job and are no longer earning SGA level income, SSA will provide you with your benefit check back without you having to reapply for benefits. That is why it is so important to report your wages to SSA when you begin to work. We want to make sure that they are aware of what work incentives you have used and what you are eligible for. This enables them to release your cash benefits directly back to you. Please also note that this is a lot of information. That is why the DRC will be working directly with you on a monthly basis to ensure you access all work incentives available to you. During your extended period of eligibility, you can move into and out of employment opportunities if needed. During the EPE, you are entitled to receive your benefit check if your gross monthly earnings are under SGA. This timeline is a great visual to help understand the work incentives. Remember, immediately after you complete your 9th 12-work period month, you move into extended period of eligibility and you are here for 3 years. Expedited reinstatement. Let's say you have re-entered the workforce, completed your 9 12-work period months, and you earned SGA level income during your 3 grace period months. You are now in extended period of eligibility as you are earning SGA level income. This would be 4 years later, correct? Okay, let's say while in your 4th year you begin to have some health issues and are no longer able to work. You contact SSA, inform them that you are no longer able to work due to your disability, and they will reinstate your benefit without you having to complete another SSA application. They will provide you with 6 months of provisional benefits. During this time, you will be asked to meet with the SSA physician so he can confirm that you continue to be disabled. If you are, the benefits continue. If you are not disabled, your benefit will stop, but you do not have to pay SSA back the 6 months of provisional benefits that they provided to you because you took advantage of their work incentives. If you are not disabled, your benefit will stop, but you do not have to pay SSA back the provisional benefits that they provided you with. You will, however, be required to complete a new SSA application. Impairment-related work expenses, affectionately known as IRWEs, is another work incentive that can be used. This work incentive can be used with both SSDI and SSI. An IRWE is an impairment-related work expense that the individual with the disability pays for out of pocket and does not receive reimbursement for. Without this item or service, the beneficiary would not be able to work. Beneficiaries are concerned about whether or not they will lose their health coverage when they return to work. For SSDI beneficiaries, their Medicare coverage will continue during the 12-work period months and for at least 93 more months following the completion of the 9th 12-work period month. However, as you will no longer be receiving a benefit, you then become responsible for paying the monthly Medicare health coverage. In this day and age, a monthly premium of $140 is actually not a bad deal. However, there is another work incentive called the Medicaid buy-in for working people with disabilities. You can apply for this benefit through the local Department of Social Services, and this benefit will actually pay for the Medicare premium. For SSI beneficiaries, please see the number of exclusions provided. After these exclusions are applied to earnings, the remaining amount is the total countable income that SSI will look at. The next slide will provide a visual that will better explain these exclusions. When an SSI beneficiary returns to work, they always come out ahead financially at the end of the month. The total monthly earnings are greater than they would be if the SSI beneficiary did not work. When working, even if you are only receiving $1 in SSI benefits, you will continue to be eligible for Medicaid benefits. For an SSI beneficiary, should you earn enough cash due to working and no longer receive an SSI cash benefit, you will continue to be eligible for Medicaid under 1619B, as long as you lost your cash benefit due to your earnings exceeding the break-even point, which means your earnings from working are more than the monthly benefit you received, and the person's disability continues. I cannot emphasize enough how important it is to make sure your monthly earnings are reported to SSA. As your DRC, I can assist you with this. SSA also now has a telephone wage reporting system for beneficiaries which actually works out better as automatic adjustments are made to your benefit based on the earnings reported. SSI has another work incentive available for SSI beneficiaries who need to save income to pay for items, services, or to achieve a specific goal. I have had several beneficiaries take advantage of this. One beneficiary purchased a condo, and the other beneficiary was able to purchase her very first car. SSA has past cadres who actually approve the past plan, and they work with beneficiaries to achieve their goals. Thank you for taking the time to become knowledgeable about the work incentives available to Social Security beneficiaries who wish to return to work. If there are any questions, please don't hesitate to contact me. My name is Veronica Jones, and I can be reached at area code 845-360-0318 or send me an email at vjones@orangecountygov.com. Thank you.